the Health Minister, has defended stretched mental health services and promised more money in the upcoming budget. Jonathan Coleman launched a national improvement program today, but as Karen Brown reports, his critics say he's just tinkering and he's failing to deal with a crisis facing the mental health sector.
Jonathan Coleman is banking on a new national improvement program lifting standards in mental health. The program will limit seclusion, standardise drug prescribing, improve patient transfers and improve the physical health of those with mental health and addiction issues.
It's clear that we've got to strengthen up access to services in the community. That's the feedback we've had over time. Primary prevention and focusing on wellness and well-being and the complex drivers of mental health illnesses.
Dr Coleman says the 5-year program will cost $7.5 million, which will come from District Health Board funds. There's also the promise of more money in the May 25 budget for mental health, but he refuses to say how much or how it will be spent.
I can't reveal details of the overall package, but what I can say is there'll be more money for mental health in the budget, and the key thing is we're taking the social investment approach.
Dr Coleman says mental health and addiction issues need a broad multi-sector approach, and he defends the government's management of the issue, saying funding has risen by 18% since 2008 and there are more staff too.
100 more psychiatrists over 8 years. Mental health nursing has increased at a faster rate than any other area of nursing. So there are more resources, there's more money going into it.
The Health Quality and Safety Commission has led work on the new National Improvement Program. Its acting chief executive, Karen Osborne, says it's definitely needed.
We know that some DHBs have put a considerable effort into improving the quality of their mental health and addiction services, but that's not consistent across the country.
But the PSA union says the social investment idea is worrying because it could target just a narrow group of people rather than all of those who need mental health services. PSA campaign worker Simon Osterman says funding increases haven't kept pace with the growing number of people who need help.
So it's not surprising that 9 in 10 people working in mental health feel under-resourced. We've had a 150% increase in the number of people coming to emergency departments with mental health issues, and the police are saying that they have record suicide calls.
Labour's health spokesperson David Clark says the new National Health Improvement Program announcement is disappointing.
The Minister's announced today that he's doing a review that's not called a review, that is going to be reviewed in 3 years' time. And that is the extent of anything that he's announced of any substance on mental health in as long as I can remember.
That's echoed by the Greens health spokesperson Julie-Anne Genter.
It's great the government is finally admitting that there is a real problem with our mental health system in New Zealand and it's not delivering for people. But I think it's going to take more than what they're promising to actually make a difference.
Julie-Anne Genter is reiterating calls for a national inquiry to identify what's needed in mental health. For Checkpoint, Karen Brown.